Good afternoon, everyone. This is Dr. Val Arkush on Monday, June the 8th, 2020, week 14 of the COVID-19 pandemic here in Montgomery County. Since our last press briefing, we've had 148 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 7,516. These positive cases are a result of a positive test for the virus, not from the antibody test. On Saturday, we learned of 82 new cases, Sunday, 33 new cases, and today, Monday, 33 new cases. In total, over those 3 days, 37 of the cases are from long-term care facilities, and 111 are from the community. The positive individuals are from 30 municipalities. 61 of our 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 3 months old to 98 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographic information. Today we have 75 females and 73 males. 1 was known to be hospitalized, 2 are known to be home in isolation, and we don't have the information on the remaining. I'm also saddened to confirm that 5 more Montgomery County residents have lost their lives to COVID-19, which brings us to 725 deaths confirmed positive from COVID-19. Today's deaths occurred between May 2nd and June the 3rd. 4 of these individuals died in a long-term care facility, and 1 we don't have information on. They ranged in age from 67 years old to 96 years old. In total, we have lost 390 females and 335 males overall. Racial breakdown, as much as we have it, are 17 Asian, 3 Asian Indian, 3 Asian Korean, 88 African American or Black, 248 white, and 366 unknown. In terms of probable deaths, and these are individuals who were diagnosed with COVID-19, but we do not have a laboratory confirmation of that diagnosis. Today we have 110 probable deaths added to our 725 confirmed positive deaths. That gives us a total of 835 probable or confirmed deaths from COVID-19. And of course, if we get laboratory confirmation on any of those probable individuals, then we will move them into the positive count. Our hospital beds continue to show improvement, which is really great news. We are now down to 155 approximately patients that are hospitalized in a Montgomery County hospital with COVID-19. Just as a reminder, at our peak, we were over 400, so we made a lot of progress in the last few weeks. However, there are still 45 individuals who require a ventilator, or approximately 29%. The situation continues to slowly improve at the 94 long-term care facilities that we are continuing to monitor. These 94 facilities have a positive case, either among their residents or staff, or pretty much in all cases both. At this point, cumulatively, since we began counting these cases, we have 2,025 cases among residents and 718 among staff. So the good news is, though, that these cases are decreasing quite rapidly. If you tuned in on Friday, you saw our 7 and 14-day averages over time, and the long-term care numbers are way, way down. So we really want to thank the staff at these facilities. This has been an extremely challenging situation for them, and we are so grateful for their partnership in this work and the fact that we've really made so much progress here. The situation continues to be stable at the Montgomery County Correctional Facility. You may recall that we've done a second round of testing at the facility because one individual who originally tested negative for COVID-19 subsequently developed symptoms and tested positive. So anyone that had not previously tested positive was tested again, and that happened around May the 21st. A total of 716 inmates were tested, and of that group, 90 inmates tested positive. We also retested all of the staff, and that happened on the 28th and 29th of May. And of the 400 individuals that were tested, we have 391 tests back. And to date, we have 8 correctional facility staff are positive and 7 medical staff that are positive. All are in isolation, and all of their direct work contacts are in quarantine. And thankfully, everyone is stable. None of the inmates that have tested positive are currently experiencing any symptoms. In terms of our community testing, just want to make sure that everyone knows that any person who either needs or wants to be tested for COVID-19 is welcome to visit any of our county testing sites. These sites are no cost, do not require a healthcare provider's order, and will test individuals of any age. We have a site in Pottstown at our Office of Public Health, Pottstown Health Center, located at 364 King Street in Pottstown Borough. Testing is available there Monday through Friday from 11 a.m. until 1 p.m., weather permitting. To register for an appointment in Pottstown, you can call 610-970-2937, starting at 8:30 in the morning of the day you would like to be tested. Norristown's walk-up community testing site is located at the Delaware Valley Community Health Center, 1401 DeKalb Street in Norristown. And testing is available there Monday through Friday, 11 to 1, weather permitting. To register for an appointment in Norristown, you call 610-592-0680, starting at 8:30 a.m. the morning of the day that you'd like to be tested. Both Pottstown and Norristown do have Spanish-speaking operators or language line available. Our Montgomery County Community Site drive-through testing site continues to be up and running smoothly. For the dates inclusive of April the 16th to June the 3rd, we've now tested 8,585 individuals and received results on 8,281 of them, which is 96% of the total. 1,146 of these individuals have tested positive. So for 40 days of testing, we are running 14% positive. If you'd like to get tested there tomorrow, the appointments for Tuesday will open at 8 a.m. Appointments can be made by going online at montcopa.org/COVID-19 under the green County Testing Information button, or by calling 610-631-3000. And both the online and phone appointments open up at 8 a.m. the day of testing. As a reminder, both CVS and Rite Aid are offering no-cost testing at a couple of locations in Montgomery County to individuals 18 or older. And you can see an updated list of those locations at montcopa.org/COVID-19. Under the County Testing Information button, click on the testing sites map. So again, just a reminder, which I'm sure doesn't need to be reminded, that we entered the yellow phase last Friday, June the 5th, and under the governor's guidelines, here is what this means. If you can work from home, we would like you to continue to work from home because you are safer at home. So if you have the option to continue to work from home, and even if you work from home, several days, and come into work 1 or 2 days, anytime at home away from large groups of people is a benefit for everyone. In-person operations must follow all the business and building safety orders and guidelines that the governor has put out. Childcare and summer camps may open, but also must follow guidelines. Restrictions at congregate care settings like long-term care facilities and the correctional facilities do remain in place, which means that there are no visitors in the yellow phase. The stay-at-home order has been lifted. Large gatherings of more than 25 are prohibited. While in-person retail is now allowable, if curbside or home delivery is possible, then that is preferable. And as I'm sure you all know, hair salons, barbershops, nail salons, any kind of massage or wellness facilities and gymnasiums remain closed. So do theaters and casinos in the yellow phase. Restaurants and bars are now limited to carry-out, delivery, or outdoor dining. If they have that option available, you should definitely check ahead. It's not obviously available in all places, but if restaurants can safely offer outdoor dining, that is now allowable in the yellow phase. I also want to announce that the Montgomery County Office of Public Health reviewed and edited a detailed plan submitted to us by the Bucks County and Southeast Pennsylvania Youth Baseball and Softball Coalition and have granted permission for them to resume practice only, no games, during the yellow phase. So this is youth baseball and softball practice only. If there are other no or low contact youth sports that would like to submit a request for permission to begin practice only during the yellow phase, please put your plan together and email that plan to Pam Lawn in our Office of Public Health. And her email is P for Pam, PLAWN@montcopa.org. And we are taking this step with youth sports, acknowledging that summer camps are allowed to have some low or no contact sports. And we felt that it was important to be as consistent as possible across these guidelines. So we are willing to evaluate plans and give you thoughts and guidance, and then we can go from there. I'm also very happy to announce that our Montgomery County parks will begin a tiered reopening starting this week. We have built this plan based on CDC recommended measures to mitigate spread of disease and also on the various guidance documents, including the Pennsylvania Recreation and Park Society. This phased reopening plan is predicated on requiring social distancing of at least 6 feet between non-household contacts in the park and wearing of masks in the parks anytime visitors will be near other park users. So by other, I mean non-household contacts. We will be limiting opening to certain areas of each park, and we will be providing signage and extra contracted cleaning services to support the implementation of this guidance. We're also moving to a carry-in, carry-out situation at these facilities. So here we go. Here are the dates. So opening June 10th are the Norristown Farm Park, and all outdoor areas will be open. The park office will be open by appointment only, and all indoor areas will be closed, as well as all pavilion areas. There will be one restroom open. If this goes well, Lock 60, Green Lane Park, Upper Schuylkill Valley Park, and Central Perkiomen Valley Park will open on June the 15th, and Lower Perkiomen Valley Park and Lorimer Park will open on June the 22nd. So a couple of notes about Green Lane Park, which hopefully, if all goes smoothly this week, will open next week on June 15th. When Green Lane Park opens, you will be able to fish there. I know we've had a lot of questions about fishing. So hopefully on June 15th, you will be able to fish there. But again, please make sure that you practice physical distancing while you are there. Also, a lot of questions, understandably, about boating and the boat storage facility. So the plan is that the boat launch at Green Lane will open also on Monday, the 15th at 6 a.m. to begin the quarantine for boats. Rental lease fees paid for the 2020 year will be credited on a prorated basis against the 2021 season fees. Anyone who wishes to speak to a parks representative regarding their boat fees should contact Green Lane Park for more information, and we will work with you. We know that many people have paid their boat storage fees prior to the shutdown, and we're very, very aware of that issue and definitely want to help and make sure everybody's got kind of made whole on that. All right, so it's coming. We're excited to be able to get those parks open. Also, just want to alert everybody that last Friday, the governor and the Pennsylvania Department of Health released a Pennsylvania county dashboard. And the easiest way to find this is just whatever search engine you use on your browser, just type in Pennsylvania county dashboard and you will see a link. This page has information on the color status of each county in the Commonwealth, the trend of cases in that county in the past 2 weeks compared with the previous 2 weeks, whether or not contacts of cases are being monitored, and whether or not the positivity of the PCR test, which is the test for the virus, is less than 10% in the past 14 days. And if hospital bed use is 90% or lower per district population. So these are going to be the metrics that the governor is telling us they will be looking at to move us into the green phase. So if you look at Montgomery County right now on that page, you'll see we're all yellow. If you scroll down a little bit, you can actually see a map of the Southeast counties and see where each of our neighboring counties is also in terms of meeting these metrics. So based on this, starting today, I will report on the positivity metric using the data from our community site. So for Montgomery County, we have a positivity rate of 13% from our community-based testing site during the past 14 days. 13% in the past 14 days. And I believe that they're looking for our positivity to be down around 10%. So we're very, very close. We're definitely getting there. Now, our community-based site does not account for all of the tests conducted in the county. However, it has reflected the overall trend in our county since we began testing there in March. So it just gives you a general sense of how we're doing, which is pretty well. However, just want to remind everybody that we still have plenty of virus in our midst and we must continue to be cautious. The county has begun very much in earnest our contact tracing. We're now doing close to 50 tracings a day. Our community partner contact tracers will be up and running by the beginning of next week. And so that will just about double our capacity in terms of contact tracing. We do have a plan in place to identify and assist in hotspots or disease outbreaks. And we have existing plans now to help individuals who need assistance to isolate or quarantine safely. And that assistance can be a place to stay, food assistance, anything like that, that we want to make sure that people can do this successfully. As I announced earlier, testing is now expanded to anyone who wants or needs to be tested. All of our county hospitals have capacity in both their regular and intensive care beds, as well as available ventilators. And our cases are slowly and steadily decreasing. So let's keep up this great momentum. We are just really doing great. But that means now that everyone's personal actions are even more important. So please be mindful of your actions when you are in public spaces. Make sure to cover your cough or cover a sneeze. Please wear a mask. Assume that you might be the one that's positive, not have any symptoms, and are potentially contagious to others. One thing I just want to give a little special attention to, particularly over the events of the last week or so, are the use of microphones and multiple speakers using the same microphone. I just want to remind anyone who's organizing an event that involves the use of a microphone to please wipe off the microphone in between speakers with some alcohol-based wipe, so that we can make sure that there's no spread through that microphone from speaker to speaker to speaker. And finally, just one last word about masks. Many of you may know that by medical training, I'm an anesthesiologist. And in the operating room, everyone in there, the physicians, the nurses, any assistants, anyone who's in the operating room wears a mask. And I'm sure if anyone's ever been in the operating room, you're very aware of this. And we do that not to protect us from the patient, but to protect the patients from us. In case any of us have a cold or the flu or strep throat or any of those things, we are wearing masks to protect the patient from us. And so I hope that you can think about wearing a mask in public in that same way, that it's possible that you have COVID-19 and don't know it and are contagious. And you could be near someone who is recovering from cancer or has diabetes or asthma or any other condition that would make them susceptible to various, very serious consequences from COVID-19. And you can't always tell by looking at someone. So just put your mask on whenever you're out in public, when you're around other people, and just do it out of respect for every person in our community. If we all do this, it will help keep our community safe. And that's all I have for today. I don't believe, Commissioner Lawrence, you had any comments today. Is that correct?
That's correct.
Okay, great. And I don't know if Commissioner Gale has any comments?
No, not today. Thank you.
All right. Todd or Teresa, are there any press questions today?
There are no questions for today.
Okay, so we are moving to a different format, or a different schedule, I should say, now that we are in yellow. Our plan is to have these briefings on Mondays and Thursdays at 3 o'clock. So you will next see me on Thursday. Unless something comes up that is important to share, then obviously we'll schedule a briefing in between that. But for now, going forward, if everything continues to go smoothly, we'll be seeing you through these briefings on Mondays and Thursdays. Thank you so much. Thank you, Sarah. And everybody stay safe and stay healthy.